10 misconceptions about people living with chronic illnesses. Living with a chronic illness isn't just a diagnosis, it's a way of life, often filled with challenges that many people just don't see or understand. Whether you're living with a condition or know someone who is, this video is for you. How many times have you heard, "but you don't look sick"? It's a phrase that can be incredibly frustrating and hurtful for those living with chronic illnesses. Imagine dealing with constant pain, fatigue, or other debilitating symptoms, only to have your struggles dismissed because they aren't visible to the naked eye. It's one of the most common things people with chronic illnesses face. This phrase often comes from a place of ignorance, not malice. People simply don't understand that not all illnesses manifest in obvious ways. They might think they're offering a compliment, but it often feels like a dismissal of the very real challenges being faced. But here's the thing, chronic illnesses are often invisible. Conditions like rheumatoid arthritis, fibromyalgia, or Crohn's disease don't necessarily show on the outside. These illnesses can cause severe pain, fatigue, and a host of other symptoms that aren't immediately apparent. Just because someone looks fine doesn't mean they aren't fighting a daily battle with their health. Or Crohn's disease don't necessarily show on the outside. The invisibility of these conditions can make it even harder for those affected to get the understanding and support they need. They might feel isolated, misunderstood, and even doubted by those around them. This misconception can make people feel invalidated. When their pain and struggles are not acknowledged, it can lead to feelings of loneliness and frustration. It's important to remember that just because you can't see someone's illness doesn't mean it isn't there. Empathy and understanding go a long way in supporting those with chronic conditions. Just because someone looks fine doesn't mean they aren't battling debilitating symptoms. Many people with chronic illnesses become experts at masking their pain and discomfort. They might smile and go about their day, but underneath, they are dealing with significant challenges. It's a testament to their strength and resilience, but it doesn't mean they aren't suffering. Chronic illness warriors, we see you, your strength and perseverance are inspiring. It's important to acknowledge the battles you fight every day, even if they aren't visible to others. You deserve understanding, support, and compassion. So let's retire this phrase. Instead of saying, "but you don't look sick," let's find better ways to show our support and understanding. Words matter, and choosing them carefully can make a big difference in how someone feels. Instead of assuming, try asking, "how are you really feeling?" This simple question can open the door to a more meaningful conversation. It shows that you care and are willing to listen. It acknowledges that their experience is valid, even if you can't see it. That one small question can mean the world. It can provide a sense of validation and support that is often desperately needed. So next time, instead of making assumptions based on appearances, take a moment to ask and listen. Your empathy can make a significant difference in someone's life. Let's talk about the L word, laziness. It's a term that gets thrown around a lot, often unfairly. When someone is struggling with chronic illness, labeling them as lazy can be incredibly damaging and misleading. People often confuse fatigue with laziness, but they're worlds apart. Fatigue is not just a fleeting feeling of tiredness. It's a persistent, overwhelming sense of exhaustion that doesn't go away with rest. Fatigue in chronic illness isn't just being tired after a long day. It's an all-encompassing, bone-deep exhaustion that can make even small tasks feel monumental. Imagine trying to climb a mountain when you can barely lift your feet off the ground. Imagine waking up already exhausted. Before you've even started your day, you're already running on empty. This is the daily reality for many people living with chronic illnesses. That's the reality for many with chronic illnesses. They have to push through this relentless fatigue just to get through their morning routines, let alone the rest of the day. Every single day requires careful planning, what we call energy budgeting. This means they have to meticulously plan their activities to conserve as much energy as possible, often sacrificing things they want to do for things they need to do. It's not about being lazy, it's about surviving. They have to make tough choices every day, prioritizing essential tasks over leisure activities, and sometimes even over basic self-care. Remember, if someone says they're too tired, believe them. It's not an excuse, it's their reality. Showing empathy and understanding can make a world of difference. Their energy isn't endless, and that's okay. They're doing the best they can with the limited energy they have. Let's support them by acknowledging their struggles and offering our understanding. Raise your hand if you have ever been told, "Have you tried this diet, supplement, or miracle cure?" We see you and we feel your frustration. It's a common experience for those living with chronic illnesses to be bombarded with unsolicited advice. Friends, family, and even strangers often suggest the latest fad diet, a new supplement, or some miracle cure they read about online. While these suggestions are usually well-intentioned, they can be overwhelming and sometimes even hurtful. While most people mean well, chronic illnesses are complex. They involve a myriad of symptoms and underlying causes that vary greatly from person to person. What works for one individual may not work for another, and finding an effective treatment often requires a nuanced, personalized approach. Medical professionals spend years studying and understanding these complexities, and even they don't have all the answers. There isn't a one-size-fits-all solution. Each person's journey with a chronic illness is unique, and what might seem like a simple fix to an outsider can be far more complicated in reality. Many patients have already tried numerous treatments, medications, and lifestyle changes, often with little to no improvement. The trial and error process can be exhausting and disheartening. Many have tried countless treatments, medications, and lifestyle changes, sometimes with little to no improvement. The constant search for relief can be a full-time job in itself, adding to the stress and fatigue that many with chronic illnesses already face. It's important to recognize that these individuals are often doing everything they can to manage their condition. If you want to support someone with a chronic illness, here's a tip. Listen, sometimes the best way to help is simply to be there, to offer a listening ear and a shoulder to lean on. Empathy and understanding can go a long way in providing comfort and support. Instead of offering solutions, ask how you can help and be willing to just listen. Be there for them instead of offering solutions, unless they ask. Your presence and willingness to listen can be more valuable than any advice. Remember, living with a chronic illness is a daily challenge, and your support can make a significant difference in their journey. Your life is over. This one hits hard. People assume chronic illness means your life is over, but that couldn't be further from the truth. Yes, many adapt, but that doesn't mean they can't work, parent, travel, or even thrive. It's not about living what society sees as normal. It's about living the way you choose to. Chronic illness may change the way things are done, but it doesn't rob someone of joy or purpose. This one's tough. It's all in your head. Hearing this is not only hurtful, it's dismissive. Chronic illnesses like lupus, MS, and Ehlers-Danlos syndrome are real, documented medical conditions. They're not imagined, and they're certainly not just stress. When someone dismisses pain as imaginary, they isolate the individual and make it harder for them to seek the care they need. Let's trust people when they tell us they're in pain. You're just depressed. This is a common misconception. While mental health is important, chronic illnesses are not just about mental state. They have physical symptoms that need medical attention. Let's not oversimplify complex conditions. You're just seeking attention. This is hurtful and dismissive. Chronic illness is not a choice, and seeking support is not attention-seeking. Let's be compassionate and understanding. You're just not trying hard enough. This is a damaging misconception. Chronic illness requires immense effort to manage daily. Let's acknowledge the strength it takes to live with these conditions. You're just overreacting. This invalidates the real pain and struggles of those with chronic illness. Let's listen and support rather than judge. You're just making excuses. This is unfair and untrue. Chronic illness limits what one can do, and it's not about making excuses. Let's be empathetic and supportive. If this video was of value to you, check out some more chronic illness, health, wellness, and autoimmune content on the channel. Bye.